have severe anxiety, and my depression gets to where I just can't do anything some days. Being a mom of 4 kids takes away and makes you have guilt for not being the mom you could be. I want to live for my kids. I want to see them grow up. I'm spinning in circles. I just want Dr. Phil's help to know what's the best steps for me.
We're back and we're talking about postpartum. Particularly, we're talking about postpartum psychosis. Dr. Torrey here has treated thousands of women. I say this is an emergency situation when somebody is in a postpartum psychosis. Is that an overstatement?
No, absolutely not. It's not an overstatement. Postpartum psychosis, as you clearly defined earlier, we have postpartum blues, which are the first 2 weeks in the postpartum time frame where there's a significant amount of hormonal changes, but those typically begin to dissipate and should not last more than 2 weeks. So these time frames are important to keep in mind. Postpartum depression, more than 50% of the time actually began during the pregnancy. So one of the things that we're really trying to do is raise awareness that pregnancy is not protective. We need to look at that time as starting to screen earlier, which is we're working on educating other doctors as well and other providers. And then postpartum psychosis is most commonly a manifestation of severe depression, and it can be exacerbated by multiple factors. We consider it an emergency, as you stated, because psychosis in itself is disrupted thought process. So thought process is usually, A, B, and then C. And in a person who has psychosis, you would go from A, B to G. And that leads to a great deal of fear in the person who's experiencing that because their own thoughts are no longer, can't anchor them. And that leads to paranoia and some of the behaviors that we may see outwardly, such as being isolative, exhibiting paranoid behavior. Those are important signs, and if somebody is taking care of one child or multiple children, it is an emergency because judgment is significantly impaired during that acute phase.
Yeah, and it's that judgment that can make something seem reasonable and rational in the moment with dire consequences, which is why it's an emergency situation. And you need somebody to reality check at the time. And are there risk factors that make some women more prone to experiencing this than others?
Several risk factors, though, that have been identified that are pretty solid. One of them is, as I mentioned, pregnancy is not protective. So if you've had a history of anxiety or depression previously, there's a greater than 50% chance that during pregnancy, especially the last trimester, there's some significant hormonal changes that take place, that the person's at risk. If there's an obstetric complication, that seems to be a significant risk factor as well. A family history, as you mentioned, for psychosis or suicide completion. And then this is harder to perhaps nail down, but we do know that psychosocial stressors that are heightened during pregnancy, such as financial stressors between a mother and her partner, seem to contribute globally. And lastly, age is inversely proportional to the risk. So the younger you are, namely under 18, the higher the risk.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.